Welcome to Avoiding Errors Involving the Patient Discharge Status Code. Again, my name is Tom Ryan, and I am with Provider Outreach and Education. Today, we want to remind you that the information in this program is for informational purposes only. Many of you are familiar that the Medicare rules, laws, regulations, and other things do change frequently, so you want to monitor the CMS website for any changes in anything that may occur. We can provide information based on facts given. So if you give me a question and there's information in it and that there's additional things that you didn't say or documentation doesn't support what you're asking us or it's given in a different way, we can only give you information based on what we have. If we don't know it, we can't use it. But Medicare rules make all final determinations, so keep that in mind. Also, CMS does prohibit the recording of this presentation for profit-making purposes. As we stated, we will post this to YouTube as a video. As you're getting ready to send in questions, you're welcome to do that at any time. Aline will be there to monitor and hopefully answer those. And again, if she can't answer those, she'll let you know. One thing I want you to make sure of is that if you are sending in a question, it goes to all panelists. We do have other staff members available to help Aline with questions and monitoring of that. So I want to make sure that everyone has the opportunity to see those so that they're aware of what's going on during the event. All right, so what's on our agenda? Well, the first thing on the agenda is to define what a patient discharge status code is, because there's some misconceptions and some things that go with that, so we want to make sure we get an actual definition based on what CMS is looking for. The next thing on the agenda is to explain the importance. Why is this code so important? What can it do and how does this affect things? And then we're going to show you a few places where you can locate some guidance on the patient discharge status code. Now, as we go through, I will mention different items and have Aline put the URL or the web address directly into the chat feature for you. This will hopefully help you. But I do want to remind you that if you did choose to download the handout, it is all going to be in the reference material on the bottom. So don't feel like you got to quickly scribble it down or anything like that. So if at any given point you have a question, I want to hear those or I want to be able to see those. I'd love for you to send those in. Make sure you send it to all panelists. I am not able to see them as the presenter. It makes it a bit difficult for me to answer questions. Okay, so let's start with that definition. So a true definition of a patient discharge status code is a 2-digit code showing where the patient was on the through date of the claim. This can be either a discharge date or the end of a billing cycle. So when we look at the claim, this is what Medicare is looking for. Now, key things to keep with this, it's where the patient was, not where you expected them to be, not what you expected to happen. It's where they were. This can play into some of the errors that we're seeing, and absolutely does. So when we look at a definition, it's through the through date on the claim or, of course, the discharge date. And where are they today? The claim must include the discharge status reflecting the discharge of the patient, and it should be in field locator 17 or the electronic equivalent. Without this information, the claim is unprocessable. Keep in mind 30, which is 30, is still a valid patient discharge status code. This is still a patient. If the patient remains inpatient on your through date, we expect to see a claim billed with 30. Now, not all types of institutions have the right to bill for claim cycles that are outside of that. They may bill admit to discharge claims or other types of claims. This may not be valid for your particular facility type, but we do expect to see this. So who writes these codes? This is not written by the Center for Medicare and Medicaid Services. It's actually written by the Uniform Billing Committee. These are available on their website. Aline just hopefully got the information into the chat feature for the website. Medicare does not restrict the limit or use of these codes in terms of which ones we use unless it really doesn't apply to something. That's how we restrict it. So when you look at the National Uniform Billing Committee, we don't have edits built in to say don't accept when that goes to a NICU. Why? Well, Medicare can have infants on their program. It's just not as common, and not a lot of people think of it that way. So it just depends on the situation in which code best fits. That means it has to be supported in documentation. Which brings us to our next slide. Correct usage. You're going to append it for the claims, again, for discharge or interim billing based on the documentation that you have. And this would include follow-up documentation. So some people ask us, okay, I don't know what that means, or I'm not really sure. And that's where verify the correct code comes in. What you need to do is have a process in place where if you know the patient's going to a facility, did they go to that facility? Can you contact that facility to find out? Or could you contact the patient, maybe have an anticipated date and say, okay, it's going to be 3 days later. Did you start home health care? Something along those lines. But it is the billing provider's responsibility to make sure this code is correctly put onto the claim. So remember, plans can change. It's a different resulting, and each patient discharge status can result in a different prospective payment system payment. So that actually can bring it up or down depending on what you have in there. That's why we have such an issue with this when we look at the review programs, which we'll talk about in just a few moments. So we really do encourage you to follow up. Make sure you go back to the patient, the facility, make sure you're checking somewhere along the way to make sure the anticipated and what actually happened are the same. This will honestly avoid those errors. We understand it's not always the easiest way, however, it is the best way. So a couple people have asked us questions in the pre-submitted questions, and they said, could you verify the best way once we get the error? Like once we know there's an error, we get an overpayment, how do we even know where to go to find out what the correct information is? The best way to do it is, one, contact the patient, their family, or someone that is available to help you with that through them. The patient's going to be able to tell you what happened, or hopefully their family will. Now, I say that, and I say someone that's available to help you with them, because remember, if they live in a nursing home, you could always contact the nursing home. If you anticipated them going to a skilled nursing facility, contact them and make sure they went there. Did you set up for a home health care program, and could you contact that home health care program to make sure everything started on time? Yes. So these are all a variety of options. Okay, keep that in mind. And we're going to get to the types of claims that come with this. So as you're going through, you have to remember that. Of course, Medicare has one exception to this for discharge to status and for what actually happened. You can discharge a patient, and I'll just give you an example here. Let's say you discharge a patient against medical advice. They're going home. Later that day, they happen to go into another facility. Key thing here is later that day. This is an exception, and it's a billing system exception. So FIS, the claims processing system, the physical intermediary standard or shared system, has an issue with this. It can't process the second claim. So we want to make sure we get this corrected. Now, this may mean another facility contacts you and says, hey, you didn't bill this correctly. Well, that's not necessarily true. Based on what you understood, you billed it correctly. You billed it because you sent them home, but later that day they went in. And so now we need that to be switched. And I'll talk just a little bit more about, give you a couple of scenarios on this one. So let's start with scenario one. Scenario one, so you discharge the patient without home care. Key here, because you're going to put a 01 on there. That's one of the discharge status codes. It's very common, 01. Now, if it's with home care, totally different discharge status code, also affects the prospective payment system. That's why we're going to use 01 in this example. Later that day, the patient admits to a different hospital. We'll call it Hospital 2. Hospital 2 submits their claim, but it hits up against yours because you had said they went home. Hospital 2's claim is saying, well, no, they really didn't go home. They're here. So what do we do with Hospital 2 claim? And Medicare system says we can't process it. So Hospital 2 will then contact Hospital 1 and say, hey, can you change your discharge status to reflect that they went into another hospital? This is what's called accurate reporting and follow-up reporting. So this can happen. And again, you're going to go in and you're going to adjust your claim. You're going to adjust your claim so that on the discharge or the through date that you're going to put patient status 02 for discharge. They went to another hospital. Once this occurs and that adjustment is all the way through the system, then and only then can Hospital 2 resubmit their claim for payment. because until Hospital 1 finalizes with the adjustment, it won't pay. So though we know that you accurately did report, you did send them home. However, on the same day, they readmitted. That does cause issues with our system. Our system just can't handle that. It's a restriction, so you want to make sure you're making that change. Let me give you another one. Discharge status against medical advice. And this is the first one that I kind of talked about a little bit, but it's another scenario. So you bill with the patient status 08 or 07, reflecting, hey, they went away against medical advice. The patient later admits to a different hospital. They're unable to get their claim paid. Well, that makes sense because when the claim comes in, it's still saying, hey, they left here against medical advice on this day. The system can't tell that it's not that the same day is there. Now, what that means is you can't have two hospitals billing on the same day, okay, unless it's admit and discharge, which is what the discharge status 02 represents. So keep in mind, we're going to go through a variety of other pieces of information as we go through this. But again, you're going to want to adjust the claim as Hospital 1 so that Hospital 2's claim does go through. This is just another piece of advice for you. So when you're looking at correct usage, always remember there's going to be some situations where it may be affecting you and you may find out later or after the fact because you believe you did it right. You followed it up, you sent them home. Yep, they're home, we're good. And suddenly something occurs differently. So we just want to make sure you're aware of that. Let's go ahead and move on to the next slide. So a lot of people ask us, okay, we're getting ready to bill and we're a hospital. What types of bills do we put this on? And this is where you're going to put it on inpatient claims with a 11X and a 12X. Now again, this will be in your handout. Hospital outpatient claims listed here. So you want to make sure that when you're using this information that, oops, sorry, I mean just scroll on there, that when you're using this status field, if it's not on one of these claims, it's not going to be applicable. So so as you look through, you want to make sure that you're checking if there's specific requirements or other things that are needed. You'll want to make sure you get that information available too, and that's in the IOM, the Internet Only Manual. It's got more references for those down below. One thing that is key to understand is that there is the hospital transfer policy, which is what we talked about up above a little bit, but I want to make sure that you are aware that there is a resource for this. So when we look at one of the 11X's, which again would be the through date or the discharge date, would be the same. CMS does have a clarification on the hospital transfer policies, and there's in the Medicare Learning Network Matters article that will help you with that, and that is SE 1411. So when you're looking at using it for a hospital basis and you're looking at the transfer policy, you want to make sure you check that out. It does give a couple more scenarios and types of information you may want, a little bit more than even just the two scenarios I gave, which were super brief and hopefully easy to understand. So a skilled nursing facility will also use this, and here's the types of claims that they're going to put it on. And again, it's the same codes. The codes don't change. It's just how did they use the information, and did they go out to the website to get all of the different information available. So let's hope they did that. So that website, again, Aline put it in the chat feature. So it's National Uniform Billing Committee information. We do have an article on our website, and I will show you that in a little while, just with some basic information. Also, home health would be correct to use this on. And these are just some different types of bills for home health. Now keep in mind, we don't process all of these because if the patient's under a home health plan of care, that is a separate MAC. However, you would still use the patient discharge status code on there. So we want to make sure that you're aware of that and that, yes, it can affect one thing or another. One of the key things with home health is that if they build the claim in, we can use that information within the processing system, and it does affect your payment. So let's say that you're going home and it's going to be 7 days before home health starts, so they're discharged home. That 7 days is a long time, and so the home health discharge would be 3 days to use the correct code for that. So we'll talk more about that in just a couple of moments here. I want to make sure you're using the correct codes. These are some common codes. We already talked about discharge to home or self-care, routine discharge. This means home health is not involved. This is one that can definitely affect your payment if you were to use it a 0.6. Okay, drive your payment up or down depending on which one you used. So when you look at this, we do anticipate this starting. You want to make sure that you're getting that information and you want to make sure it's available. So this is where you want to check back. Hey, did your actual home health start? An example of this was we had one that came in and they were assigned an error. They anticipated the home health starting on, they discharged the patient on Wednesday and home health was supposed to intake on Friday. That would only be a couple of days, so yep, discharged to home health. However, it got delayed and didn't discharge until a week, so it was 10 days. Okay, that would be a different one. So they should have verified with the patient is what Medicare is saying. So you want to make sure that you have all of those different types of information. So that's where you're going to look at those two common codes. 07, again, we talked about left against medical advice really briefly, but I do want to remind you, left against medical advice is exactly what it sounds like. The patient no longer wants to be inpatient. This is their decision. They have the right to do that, and that's perfectly fine. But remember, that's one of them that has that caveat that says, oh, they left Medicare advice, but later that day they went into a different facility. Okay, now we need to make sure that we get that changed because that's going to affect how it's going to be billed. So, 20 expired. That is one that is commonly not used correctly. So patients do pass away. We understand that. And what will happen is this will go on to something and we'll be like, but that patient doesn't have a death date. But the patient's still alive and they're still getting claims and causes some other issues and interesting errors with that. So of course, we want to make sure it's used correctly. Now sometimes it's used correctly and the claims are coming in incorrectly. We understand that as well. So just make sure that you're using it correctly. And last on this slide is still a patient, very common one that's used. If you're billing an interim, a skilled nursing facility, you're billing every 30 days, but the patient remains, that's fine. Long-term care hospitals, etc., they may still be in your facility, and that's perfectly okay. We just want to make sure that you get that documented correctly so that we know what's going to happen. Upon the end or the discharge, you want to make sure that you get that information. A lot of times we'll see still a patient for someone on an observation care or an outpatient style service. That's not the correct discharge for that. They may be still under observation care, but during that claim, that through date, were they still with you at that moment? You let them go under observation care, so we wouldn't expect to see still a patient. Instead, we would expect to see discharge to, could be home or a variety of other sources. So you want to make sure that when you're looking at this one, you're actually accurately reflecting that they are still an inpatient in your facility. So what types of things would happen with this? Well, first, it does create an error. Now remember, Medicare defines an error as anything that's wrong. It doesn't necessarily mean an overpayment or underpayment. However, it can affect that. So there are some times when Medicare will say, hey, we have an informational error. This is a no payment error. And that's okay, except we still have to get it corrected. So we'll look at a couple examples here, and I'm just going to talk through them. The first one is actually from the Office of Inspector General. So let's talk about this example. An acute care hospital admits a patient to inpatient. Admission is for complication from heart disease. The patient undergoes a coronary bypass procedure. After day 4, the beneficiary discharges home. Within 2 days after the discharge, the home health agency begins the service. That is key right there because 2 days means it's within that 3-day time period that we talked about. So the claim contains patient discharge 01. They're discharged home without, this is routine care, they don't have home health care coming in and it's not anticipated. This would allow this particular claim based on the diagnoses under the prospective payment system at $32,241. The correct patient discharge on this one should have been 06. We did anticipate them going home with a home healthcare agency, and that did begin 2 days afterwards. So this one should have allowed at $17,982. This created an overpayment of $14,295. So you can see by billing that incorrectly, it actually creates a $14,000 overpayment, and all it was one code that was wrong. The rest of the claim was perfect, no other problems, just that one code. So again, this is just to emphasize the importance of Discharge 01 versus Discharge 06, that home health service in anticipation. Also, this is why we want to make sure we contact them. What if you had said, hey, we are going to say 06 discharge status because we anticipate this starting? Then, in reality, it didn't start. The example we had was, remember, it was supposed to start 2 days after they were discharged, but really it didn't start till 10 days. And this is due to scheduling errors and things going on with the home health agency. It didn't have anything that you could have anticipated. But because of that length of time, you are entitled to the other money, the $14,295 in our example. So then the $32,241 should have been the allowed amount. So you can see this can drastically affect that revenue, and it's very important that we look back and forth with this. I'll give you another example, and this is from the CERT, the discharge status use of disposition 03, discharged to a skilled nursing facility. When they submitted the documentation indicating the beneficiary was discharged to a rehab facility, and it should have been a disposition discharge disposition 62. In other words, 03 is a SNF, but a rehab facility, inpatient rehabilitation facility is the 62. They're two different facility types. This resulted in an incorrect payment to the discharging hospital, and the admitting facility wasn't able to be paid due to the incorrect billing of the discharge facility. So now this discharge facility has to go back and correct their claim to allow the other facility to be paid correctly, or to even be paid at all. So you can see there's a lot of intricacies that go underneath here, and that can definitely affect this information. So we want to make sure that when you get a rejection, and we've talked about this a couple of different times, you may need to go to the other facility. You may need to let them know, hey, this is what's going on. Your patient discharge status code is showing this. If you're unaware, you get a rejection on a claim and you're like, this doesn't make sense, and I'm not sure why it's RTPing. It is pretty clear in the system, but you can always go to customer service and be like, I see that it returned a provider. Can you explain why? And then they can explain it a bit more if they need to. So you can get some more information that way. All right, so as I said, there's a couple of things I do want to cover before we leave this information. I'm going to go ahead and hit escape here for a moment. And what you'll see come up is the website. Let's start with our website. So on the website, one of the pieces that we have out on our website and available for you is something that Aline has hopefully added at this point into the chat feature, but I did want to show you where it's at. So you want to make sure that you're either in J5A or J8A up here. Because if you're in B, it's not going to be there. It's not applicable to a Part B 1500 or 837P. When you come in, you're going to go to claims. Now, if you didn't see that, it was, again, Topic Center, claims. You could also filter for patient discharge status code, and you can search that way, however you want to do it. I'm just going to filter for it. Then I don't have to try to look down below. So you can see here's what I'm looking for. It's the same article, it's just listed under two different headers. It just gives you some other examples. A couple of things I do want to point out. If you're billing an outpatient claim and it's for anything related to one of these bills, then yes, you do still need to make sure that you have the patient discharge status code on there and that it's correct. So when we look at this, you have to make sure that if you're billing any one of these, doesn't matter which one. Here are some common ones that we see. So this is, again, not a full list, but here are some common ones that we see, and we've talked a little bit about some of these. So you want to make sure that you're looking at the different ones and that you are aware of them. Now, if you say, hey, we have this National Uniform Billing Committee and we have the full list, we just aren't sure which one to use, go back and look at the documentation and contact the patient to see what's actually going on. That is a key thing that we want to make and continue to make sure. All right, so that's one article that I really do want to bring up and I really want to make sure you're aware of. Let's see. I'm going to ask Aline if there are any questions at this point. So Aline, do we have any questions?
We did get one question, and I did answer it in the chat, but just in case somebody didn't see it, it was asked, do the patient discharge status codes also apply to observation claims? And I did say that if the type of bill that they're using is one of the ones that you showed on the screen, then yes, it does. But the edits mostly pertain to the inpatient ones because it can affect their payment. And then the other thing that was submitted in the chat was more of a statement than a question. But it says, I think there are a lot of facilities that are not aware of post-discharge admissions to other hospitals. Sometimes only until the Medicare claim rejects do we find out about the other admission. So maybe in those cases where they thought the patient was going home or the patient did go home and ended up admitting somewhere else. I don't know if you want to address that. It wasn't really formed as a question.
Sure. So again, the key to the discharge status code is it's what actually happened. So when we look at this question, or I guess this comment, yes, a lot of facilities are unaware. We're not denying that. We're not saying that that doesn't happen. What we're saying is you should be aware and you need to somehow come up with some mechanism within your facility. Now, Medicare is not going to tell you you have to do this or you have to do that. That's definitely not where we're coming from. What we say is do your best you can. Try to make yourself aware. Maybe you do follow up with the patient. Maybe before you bill that claim, you give have a social worker follow up, a community worker follow up and say, hey, did everything go as anticipated? Did the home health care start for you? It's a way of making sure that what actually was anticipated happened. So you can use whatever mechanism you have in place to do that. Now, again, we actually have a facility that said, hey, you know what we do? When we know they're in a facility, and I'm just going to give you an example, if they live in a nursing home or if they're going to a skilled nursing facility, those were the two ones that they use in particular, they actually will go back to that facility to make sure that, did they go into skilled nursing care when we anticipated them just going back into the facility? Or we thought they were going to go to skilled nursing care and they met and they got there and the skilled nursing facility was like, yeah, these people don't meet this requirement. Whether it's a 3-day qualifying stay or whatever the situation is. Maybe they were in observation care for 3 days, so they don't meet the technical requirements either. So you thought you were discharging to certain other things, and they've contacted the facility directly. In terms of people not being aware of it, that's where a lot of the errors actually do come from. It is not intentional with this particular set of errors, whether it's the CERT, the RAC, the Recovery Audit Finder, Audit Contract Finding, comprehensive error rate testing finding, the example that I use from the Office of Inspector General or OIG. It's not that people are intentionally doing this wrong. Sometimes it literally is they don't know. So the errors are coming up because they didn't know. So it's just something to keep in mind and something that I did want to talk about there. So that's a great observation. Just remember, it's always about what actually happened, not what we anticipated. And that's part of the key when we answer questions and we look at the patient discharge status code. Definitely not saying it's an easy process. Just build it in if you can. Make sure, again, Aline did mention this, but I did pull this article up. And again, if you're billing on any type of hospital claim, and these are the different types, whether it's outpatient or inpatient, and observation care falls under this claim type, then yes, you need a patient discharge status code. Yes, you will. Now, as Aline said, the edits and audits are a little different, right? A lot of the edits are built in around the inpatient claims. Well, this makes sense as this can affect a lot more payment. So some of the non-payment errors are actually going to be your outpatient claims. There's not as many edits and audits because there aren't as many errors in terms of dollars and cents. So we sometimes call those no payment errors. It's still incorrect. So when you assign an error, or when an error is assigned to you, you still need to make sure it's correctly billed and all of those different information is reflected correctly. All right, so again, take a look at this article if you have questions. Definitely take a look at the information on the bottom for resources. They are some really helpful pieces of information. A couple of things I do want to cover. And again, anytime if we get a question, I'll call out to you. But a couple of things I want to talk about before I go into closing comments or before we have anything. One, many of you may have noticed that we've made some improvements or changes to our education in the way in which we do this. So our education is being moved from the Learning Center, and you may have noticed that there's a note on there saying, hey, this is going away. The Learning Center will be going away soon. And so we understand that that is happening. This was done because you requested it. So I want to make it as clear as possible. We've looked at it. We've looked at the information coming from providers. What do you want? What can we do to make this happen? You saw for a long time the Learning Center was in an update phase, and the updates didn't ever seem to be coming. So the enhancements got to the point where we said, you know, it's probably better if we just eliminate it. That brings us to this webinar. This webinar is one of the few remaining that the registration occurred in the Learning Center, and by few, we stopped taking registration for anything starting in March, and they're all taken in WebEx, so the process is easier for you. Our goal was to then allow you guys the opportunity to look at different types of items. A couple things can happen. One, if you're looking on the, on our website, go to the training page. This is important. This one in particular too, we're going to post Encore presentations onto the Encore presentation page. So while we'll send you an e-news if you want to know when this is available, best way to check is just come out and check the Encore presentation page. I'm going to scroll down here for just a moment. You can see all the Encore presentations are listed, and these will actually directly link you to the YouTube channel, to the video. I'm not going to take you out there for any of them. We can post follow-up documents here. So depending on the type of information that I get, if any, there could be a follow-up document. So, you know, it could be a PDF, which is what this one is, or it could just be a follow-up page. But again, remember, for this particular event, you want to make sure you're emailing us. So we've done this. This is where you're going to find the Encore for this presentation. It's not going to be in the Learning Center. On this page, and then also any follow-up. Now again, if the follow-up is claim specific or we feel it's better sent to you, we will do that via email. Let's go back to this guides and resources under the training section. So for future registration, you're going to look at the live events page, the new live events page. This course listing will provide you with all of the different courses we have available. Now, they are listed by date, so you can go out and say, I can attend on the 21st, and here's what's going on there if you want to. What's great about these is they will utilize the new registration process. So I will just open depression screening bundling. You're going to see a little message saying you're leaving the website, and this is what that process will actually look like for you. Oops. So you can see it's going to have a registration process directly on WebEx. We're going to gather a few fields, and you can complete those. Once this is complete, there will be information added down on the lower left corner underneath the agenda. This is where you're going to download your handouts and available information. Now, if they're not available when we build the course, we will have them available to you via an email that the system actually generates. So maybe 3-4 days before, you'll get an email reminder. I'll say, download the course material. You can go and do that. This makes it less steps for you. No more logging in, trying to find it, going to the course, doing all those different types of back and forth things. We're good. This course is still a little bit of a hybrid. Again, you're going to have some information available in the Learning Center, but all the information will also happen from here. So if you do want to submit a question, and remember we're on the live events page, so I went back to that. I'm just going to scroll down for a minute here. You can see post-event questions and how to do that. So you want to make sure that if you do have a question, you can actually come to our website to find out how to do this. This continuing education unit is a little different than what we did before, and it does apply to this course, so I want to highlight this. We are going to send you in a follow-up email. On the bottom of that email, it's going to say Certificate of Achievement right on the bottom of the email. This is what we use as a certificate. It's going to give you 1 contact hour with us for today's course. It's all going to be there. It's going to allow you to do all of those different things. Now, the system does have to generate that. So it says, hey, did you attend, and a variety of other things, but it's a system-generated email. So a little bit of a different stuff going on there to kind of highlight some of those big training changes coming up. Also, if we're out here and you don't want to go in and you don't want to go all the way into the encore presentations, or you don't want to have to go in, through the topic center, there's a variety of quicker links that may help you. So I'm back on the first page, which is the home page. It's just wpsgha.com. If you look under the right side, you'll see one of the items listed in this column is quick links, and that will take you back to the live event page. But if we scroll down a little bit more, you'll also be able to link directly to our YouTube channel, and this is important because this is where the content's going to be. Then you'll find out coronavirus, and then you'll have educational opportunities. Again, these will take you back to that interesting information that you need. So where will this be on our YouTube channel? This is our YouTube channel. For those of you that are not familiar with it, I'm going to recommend you go to a playlist. That's not there yet. It's obviously not done being recorded yet, but we will put it into 2 different playlists. One will be this billing playlist right here. So it's a billing UB04 claim form playlist. The other one will be the Part A claims processing playlist. So you'll have those available to you. And this will be within there. You could also, go to, oops, I'm sorry, not home. You could also go to videos, and we'll have it available here as recently uploaded or popular, just depending on how you want to get to it. So we're going to try to get you a variety of different ways to let you know it's available. You can go out there and take it and all those different types of information. All right, I'm going to jump back here again. A lot of you may be familiar with the fact that we do ask you to take surveys, and surveys come from the Learning Center is where you're used to link to it. Here's what I'm going to do for this one. I'm going to go ahead, and when we stop the recording and when we end this webinar, it's going to give you a redirect link. It's going to give you a pop-up box that says, hey, your host wants to redirect you to an outside source outside of WebEx. If you select OK on that and say, yep, let's go there, that source is actually the survey. You can take the survey, get it done directly, and go ahead and move on. We also still allow the survey access at this point for this course from the Learning Center. However, that will be going away soon, so you want to be able to do that. In the reminder email that will come out, which will have that certificate, or I'm sorry, in the follow-up email that will come out, so again, follow-up email, it's going to have that certificate in it. It's going to have a link in there too if you want to take the survey at a later point. So we're going to give you a few different options to take that survey. We definitely want to hear what you have to say. One other item that I definitely want to show everybody, and well, it doesn't necessarily relate to patient discharge status. It does relate to some facility billing and some other things that we're having going on. So I'm right on the home page again, just that first page, and I'm going to use the Medicare news to do this. Scroll down towards the bottom. And on February 14th, we published an article. This is an article from CMS that they've asked us to publish because there is an issue going on. And the bigger issue is providers and suppliers, providers including facilities, are denying service or entry if the patient has a group health plan open. And this isn't acceptable to CMS, so they want to make sure this isn't happening. So key things right here, you have to continue to see the patient even if there is an MSP occurrence. This claim can be appealed through the appeals process or a variety of other things. They don't want you to deny the service based on the fact that there's an MSP file open in the system. And again, you can check a variety of different sources to find that information. Okay. I covered all of the content. I want to ask Aline Wool to see if there are more questions at this point.
No, we do not have any other questions at this time. I've been trying to share links to the articles as you've been showing them, so hopefully everybody can take a look at those at their opportunity, but no questions at this time.
All right, thanks, Aline. Let's go ahead and finish up. Again, there are resources on the bottom of that handout. There are resources in the Learning Center. It's a separate last module, not a mandatory module. If you want to look at more information, any of that, we do recommend you take a look at those resources. A couple of them that are out there. One is the Internet-only manuals. These are the claims processing and the program integrity manual. One of those resources is the one that actually gives us the authority to do this type of a review, because it is part of a bigger review process. That's the program integrity manual. Take a look at the claims processing manual just for some more instructions. Always make sure that you follow the information in the claims processing manual. I think it's chapter 25, and that's just the basic to how to fill out a UB04 form, but you want to make sure you get all that information in there as well. Always when you're looking at this piece of information for patient discharge status, you want to make sure that you are verifying that what you thought happened actually happened. And yes, sometimes that does mean making an additional contact or seeing what actually happened with the patient. So there's so much going on. So as we go through, let's talk a little bit more about some final comments here. This event is available for the next 10 days. That means I'll take questions, which we already talked about how to submit those, and that's through that email process. Make sure you have the information available in there. Follow the directions on the website. We'll take those for 10 days. Once we get those in, we'll compile. We may directly email you back, or we may have gone back to a variety of different pieces of information there. So they may be posted on the Encore page. It just depends on the type of question and what's coming in for that. So we want to make sure you're aware of that. We do have to wait a couple minutes to mark you complete. Now, a couple minutes could actually be 6 hours. It just depends. What I'm looking for is for WebEx to generate a report on who actually attended today. Then I can go in the Learning Center and mark you complete. If you say to me, hey, I don't want to go in the Learning Center anymore, that's okay. We're good with that. Here's why. Your survey is going to be available to you in a couple of different methods. I've already explained those methods, but again, it's going to be a pop-up box, and it's also going to be sent to you with a link. And you can actually select that link and then move on to that. You can get your certificate directly off the email follow-up, which will come out in an hour or two. And that email follow-up will then contain the certificate on the bottom. You will have to work with the governing agency over your CEUs to determine the best way to get them that information, whether it's to put it into a PDF or however they would like you to do that. So I'll make sure you do that. Yes.
I'm sorry to interrupt you. We did get a question from Amy, so I wondered if you would take that question. It says, if our claim is held up due to another provider billing the incorrect status, we've tried contacting them for 2 months and gotten nowhere. Is there anything else we can do? Do you have any advice for Amy?
Yeah, actually, Amy, one thing to keep in mind is part of your participation agreement, and whether it's yours or the other provider, it doesn't really matter, is that they have to accurately bill. So if they're not doing that, this is something that CMS can be involved in. Unfortunately, we don't have a whole lot of involvement with that, but you could ask for advice, or you could go to your regional office for additional support. So there's a variety of different factors involved in that. It's not really something that WPS per se can get involved in. You can write to us if there's something else going on. I'm going to take this one back just so that you are aware, and I'm going to look a little bit further into it and see if anyone else has any other advice. But step one, anybody on my team have any advice in addition to what I have other than regional office?
My advice, Amy, would be to contact customer service first to make sure that maybe there's somebody that's already working with that other provider, or if there's any records that have been requested or anything like that, they can at least, you can make them aware of the situation. That would be where I would start. I don't know if you've already tried that, but that would be my advice.
Thanks, Aline. So good luck with that, Amy. We do know that that is a situation that happens, and we are aware of it. We also know that due to the CMS regulations, error will be assessed, and unfortunately it's going to be on either your claim not paying or eventually their claim. So a variety of different things that can happen there. That is all I have. So barring any other questions that came in, or if anyone else has comments, I'm going to throw it out to my team and see if anyone else has anything else they'd like to add.
There are no other questions at this time.
All right. So on behalf of Provider Outreach Education, Aline and myself, I want to thank you for participating in today's event, and you may now disconnect.